Imagine waking up one day, and the world you knew, including the intimate connection with your partner, feels irrevocably altered. For millions worldwide, a stroke can suddenly change not just physical abilities, but also the very fabric of a relationship. The journey to recovery is often long and challenging, but among the many hurdles, one topic frequently remains unspoken: intimacy after a stroke. It's a deeply personal and sensitive subject, yet vital for the emotional well-being of both the survivor and their partner. Many couples, like Michel and his wife Sarah from New York, find themselves navigating uncharted waters, grappling with fear, uncertainty, and a sense of loss. Michel, a lively retired teacher, loved his evening walks and the quiet intimacy he shared with Sarah. After his stroke, simple gestures became monumental tasks, and the thought of physical intimacy felt daunting, even impossible. This video is for every couple like Michel and Sarah, for the stroke survivor, and for their silent heroes, the partners. We understand your fears, your questions, and your longing for connection. Today, we'll explore practical, empathetic ways to rediscover intimacy, rebuild confidence, and strengthen your bond, not just despite the stroke, but perhaps because of the journey you've shared. We'll provide a roadmap to understanding, communication, and re-exploration, ensuring that love and connection can thrive in new and profound ways. Part 1. For the partner, understanding and support. Let's begin by addressing the unsung heroes of this journey, the partners. When a stroke impacts a loved one, the partner often carries a unique burden, silently navigating their own fears and anxieties. Michelle's wife, Sarah, confessed that after his stroke, she felt a profound sense of loneliness. She worried about hurting him, about his potential disinterest, and about the future of their physical intimacy. These fears are not only valid but entirely common. You might fear causing pain, or that your partner no longer desires you, or even feel abandoned and isolated. It's crucial to acknowledge these emotions, not to suppress them. They are real, and they deserve to be recognized. Suppressing them only builds a wall between you and your partner. The first step toward healing is understanding. Knowledge truly is power. A stroke can affect a person in myriad ways that impact intimacy: physical limitations, changes in sensation, fatigue, mood swings, and even medication side effects. For instance, Michel experienced significant weakness on his right side, making movement difficult, and he also battled post-stroke depression, which naturally dampened his libido. Understanding that these are often physiological or neurological consequences, rather than a personal rejection or lack of love, can alleviate immense guilt and confusion. It helps both partners realize that it's not you, it's the stroke. Without this understanding, Sarah might have interpreted Michel's withdrawal as a sign he no longer loved her, when in reality, he was struggling with profound fatigue and the emotional weight of his condition. So, what should you, as a partner, do and not do? Here's actionable guidance. Do. Actively suggest affectionate gestures. Simple acts like holding hands, a tender hug, or a gentle kiss on the forehead can reaffirm love and connection without pressure. Sarah began by simply holding Michel's hand during their favorite TV show, a small gesture that reopened the avenue for physical touch. Offer compliments and express appreciation. Remind your partner of their strengths, resilience, and how much they mean to you. Focus on their personality and spirit, not just their physical state. Listen with an open heart and mind. Create a safe space for your partner to share feelings, fears, and desires without judgment. Practice active listening, truly hearing them rather than waiting to speak. Be patient. Recovery is a marathon, not a sprint. There will be good days and bad days. Respect your partner's pace and emotional state. Ask what feels comfortable for them. Open communication is key. Use simple questions like, "How does this feel? Is there anything you'd like me to do differently?" Do not create pressure. Avoid making your partner feel obligated or as if recovery hinges on sexual performance. Pressure fuels anxiety and withdrawal. Show pity or condescension. Empathy is crucial. Pity can be disempowering and make your partner feel less capable or desirable. Treat them with respect and equality. Remain silent and pretend everything is fine. Ignoring the issue fosters resentment and widens the emotional gap. Michelle and Sarah learned that confronting discomfort, though challenging, was the only path forward. Part 2. The no-blame communication technique. Now, let's talk about the bridge that connects understanding and action, communication. It's often the most challenging part, especially when emotions run high. Here's a simple yet powerful model we call the no-blame technique. It helps you express feelings and needs without making your partner feel attacked. Fostering dialogue instead of an argument. This is exactly what helped Michelle and Sarah navigate some of their toughest conversations. The model has 3 steps. Step 1. Start with your feelings. Begin with I feel, to center your internal experience and lower defensiveness. Example. Instead of, you never touch me anymore, say, I feel a bit lonely and I miss our closeness. Sarah said, Michelle, I feel a little disconnected from you lately. Step 2. State the facts, not assumptions. Follow your feeling with a factual observation about what happened. Connect your feeling to specific, observable behavior. Example. When we don't hug before bed anymore. Sarah added. When we don't spend quiet time just holding each other like we used to. Step 3. Propose a specific, actionable solution. End with a clear, small, achievable request. Example. Could we spend 10 minutes tonight holding each other and talking? Sarah concluded. Would it be okay if tonight we spent 15 minutes in bed holding hands and talking about our day? This simple, direct approach opened the door for Michelle to respond with empathy rather than defensiveness. Common mistakes to avoid. Assuming you know what your partner thinks or feels. Ask instead of mind reading. Withdrawing or stonewalling. Silence can be deeply damaging and communicates disinterest. Using always or never statements. They trigger defensiveness and shut down dialogue. Bringing up past grievances. Stay with the present issue. Advanced tips. Practice active listening, full attention, nodding, eye contact, and brief summaries to confirm understanding. Example. So, if I understand correctly, you're feeling overwhelmed by the physical challenges. And that's why you've been hesitant. Choose the right time and place, not when tired, stressed, or rushed. Use supportive nonverbal cues, soft tone, open posture, gentle touch. By consistently applying the no-blame technique, Michelle and Sarah rebuilt trust and created a safe space where both felt heard and valued. Part 3. Rediscovering intimacy together. With improved understanding and communication, you're ready for the next phase, rediscovering intimacy together. This isn't about returning to how things used to be, but about exploring new possibilities and finding joy in different forms of connection. Michelle and Sarah initially felt overwhelmed by physical limitations. Michelle's right-sided weakness made many positions difficult or impossible, leading to frustration. With patience and creativity, they began to explore, try new positions, forget preconceived notions of what sex should look like, prioritize comfort, support, and ease of movement, positions where the unaffected partner is on top, or side-lying positions, can reduce strain and allow greater control and comfort for the stroke survivor. Michelle found that side lying, with Sarah gently supporting him, allowed more comfort and less exertion, making the experience more pleasurable for both. Use pillows for support and stability, and consider times of day when energy is higher. Schedule date nights. After a stroke, spontaneity can be challenging due to fatigue, pain, or medication schedules. Scheduling dedicated time for intimacy, even cuddling or talking, removes pressure and builds positive anticipation. It signals commitment and priority. Michelle and Sarah began with intimacy appointments every Wednesday evening. Sometimes it was a long warm bath, a sensual massage, or simply talking and holding each other. The ritual reduced performance anxiety and focused them on shared experience. Focus on pleasure, not performance. The goal is joy, connection, and mutual satisfaction, not necessarily orgasm or penetration. Expand your definition of intimacy: tender touch, massage, kissing, oral sex, shared baths, simply being close. Michelle realized that the pressure to perform was the biggest barrier. Shifting their focus to different types of touch and sensation uncovered new layers of intimacy. Step-by-step sensual re-exploration. Start with non-genital touch, gentle massage, hand-holding, caressing arms and shoulders. Share what feels good. Explore full-body massage to relax and reconnect without sexual pressure. Experiment with sensations. Varied textures, silk, feathers, temperatures, warm towels, aromatic oils. Reintroduce genital touch gradually if both feel ready. With clear communication throughout, there is no right or wrong way to experience pleasure. Advanced romance tips. Keep dating each other outside scheduled intimacy, movie night, park picnic, simple dinner out. Express affection daily. Small gestures sustain the spark. Seek professional guidance. A sex therapist or rehabilitation specialist can offer tailored advice and support. Michelle and Sarah's journey wasn't linear, but by embracing new positions, scheduling moments of connection, and focusing on shared pleasure, their love and intimacy deepened, becoming more resilient and profound than ever. Reclaiming intimacy after a stroke is a testament to the power of love, resilience, and teamwork. Understanding the unique challenges faced by both the survivor and the partner is foundational. Open, no-blame communication is the bridge that allows feelings and needs to be safely expressed. Rediscovering intimacy means welcoming new forms of connection, focusing on pleasure over performance, and creatively exploring what feels good for both of you. It's about adapting, not giving up. Your relationship is a unique journey, and this video is just the beginning. Start these conversations, even if they feel difficult. If this guide helped you, please give us a thumbs up, share it with someone who might benefit, and subscribe to Golden Wellness Guide for more supportive content. We invite you to share your experiences or questions in the comments. Your insights can help others on similar paths. Remember, you are not alone. Thank you for watching, and remember, every step forward, no matter how small, is a victory.